Greetings, family. My name is Dr. Kenny. I'm the lead clinical pharmacist for Nyan Pharmacy, and this presentation is an addition to our series, Diabetes, also known as the sugar. The American Diabetes Association Standards of Medical Care in Diabetes 2021 is the primary reference material used to support this presentation. This series is an introduction to diabetes for the general public. Whether you're caring for someone with diabetes, you or someone you know has an appointment to meet with a healthcare provider to discuss diabetes or prediabetes, and you want to have more information or have a better grasp of knowledge on the disease before you meet, this presentation would be helpful for you. If you're a person who is just curious and just wants to learn about the disease, then this presentation is for you as well. One of the major goals of the Nyan Pharmacy channel is to provide health and drug information to our community. So to be notified when we post actionable information relative to you and your family, please like, share, and subscribe. Now, just a little housekeeping. Copyright disclaimer. Under Section 107 of the Copyright Act of 1976, allowance is made for fair use for purposes such as criticism, comment, news reporting, teaching, scholarship, education, and research. Fair use is permitted by copyright statute that might otherwise be infringing. The content provided by Nyan Pharmacy is designed to educate the general public on healthcare and medical issues that may affect their daily lives. The information is intended to support, not replace, discussion with your doctor or healthcare professionals. Okay, so the previous presentation closed with us reviewing the classifications of diabetes. This one is going to pick up on that note as well. So let's get to it. So type 1 diabetes. 75% of these patients are going to develop type 1 diabetes before the age of 20. They have acute hallmark symptoms, and acute meaning abrupt and severe. Symptoms such as polyuria, which is frequent urination. These patients may urinate all through the night. It's just really excessive. Polydipsia, which is an excessive thirst. And 1/3 of these patients are going to present with diabetic ketoacidosis, and that is a severe complication of diabetes. They may have nausea and vomiting and severe stomach pains. 40% of the patients who are adults that have diabetes, they will present with diabetic ketoacidosis after several days of experiencing the acute symptoms or the hallmark symptoms. Now, patients with type 2 diabetes, they may be symptomatic or asymptomatic. They may have advanced complications, and type 2 diabetes is typically seen in adults. It's becoming more common in children and teens, and that's in large part due to lifestyle factors. And it's also very important to identify the risk factors associated with type 2 diabetes. Now, type 2 diabetes accounts for 90 to 95% of all diabetes cases. Most of these patients are going to be overweight or obese. They often have a long pre-symptomatic phase before the type 2 diabetes is diagnosed. And the type 2 diabetes may go undiagnosed for many years because the hypoglycemia develops gradually. It's a progressive disease. So at the early stages of the disease, it isn't severe enough to notice the symptoms caused by the hyperglycemia. However, the undiagnosed patient is still at risk for complications associated with diabetes. Now, just a quick review of the symptoms. Patients with type 1 diabetes, they may present with polyuria, polydipsia, polyphagia, that's excessive hunger, weight loss, fatigue, and irritability. Now, the type 2 diabetics, they may present with any of the symptoms that you see in the type 1 patient. And they may have frequent infections, blurred vision, they may have sores or bruises that are slow to heal. They may experience numbness or tingling in their hands and feet, or they may be asymptomatic. A doctor may order just routine labs, and they may notice that the patient has just really high glucose levels or marked high glucose, and that may prompt them to do more tests, and they may notice or identify that the patient is diabetic there. So there, it is important to recognize or know the risk factors for type 2 diabetes. Now, criteria to test for diabetes are prediabetes in asymptomatic adults. So this test should be considered in adults who are overweight or obese with one or more of the following risk factors. That is a first degree relative with diabetes, first degree relative, meaning a parent, a sibling, or a child. Patients or people who are at high risk, who are high risk race or ethnicity, such as African American, Native American, Latino, Asian American, and Pacific Islanders, people who have a history of cardiovascular disease, people with high blood pressure or who are on high blood pressure medications, people who have HDL of less than 35 or triglycerides greater than 250, women who have polycystic ovary syndrome, people who are physically inactive or have clinical conditions associated with insulin resistance. These patients with these risk factors who are overweight and obese, if they have one or more of these risk factors, they should consider being tested for diabetes. Now, patients who are pre-diabetic should be tested yearly. Women who were previously diagnosed with gestational diabetes should have lifelong testing at least every 3 years. All other patients should begin testing at 45 years of age. Now, if the results are normal, the testing should be done every 3 years or sooner, depending on the initial results and the risk factors. All patients who have HIV should be tested for diabetes and prediabetes. Now, risk-based screening for type 2 diabetes and prediabetes in asymptomatic children and adolescents in a clinical setting. Now, we're going to consider testing for youth who are overweight or obese and who have one or more of these risk factors and on the strength of their association with diabetes. If their mother has a history of diabetes, or if the mother had gestational diabetes during the child's gestation, there's a family history of type 2 diabetes in the first or second degree relative. Second degree relative is is a niece or a nephew, an aunt or uncle, a half brother or half sister, or grandparents. If the person is a high risk race or ethnicity, or if they have signs of insulin resistance or conditions associated with insulin resistance. So now we're going to review some diagnostic tests for diabetes. The hemoglobin A1c is the first test that we're going to review. This test is also called the A1c test or the hemoglobin A1c, or the other names listed here. This test estimates this value is going to be an estimate of the glucose in your bloodstream over the last 3 months. So the glucose in your blood attaches to hemoglobin, which is a protein that carries oxygen in your blood. When they attach, it forms the hemoglobin A1c. Now, the more glucose that is in your blood, you would have more available to attach to the hemoglobin. Now, the hemoglobin A1c reflects the percent of hemoglobin A attached to glucose compared to the total hemoglobin A in your bloodstream. This sample is going to be drawn from a vein or a finger stick. The next test is the glucose test. It's also called the fasting blood glucose test, blood sugar fasting, blood glucose random. It just has several names. Now, this test can be used to screen for diabetes or prediabetes. It can detect hyperglycemia and hypoglycemia. That's low glucose. It can be used as a diagnostic tool for diabetes, and it can be used to monitor glucose over time to determine the effectiveness of interventions. And interventions meaning diabetes medication, lifestyle, diet, just whatever interventions that are being taken. So now, how the sample is drawn is going to depend on what it's being used for. So right now we're talking about screening and diagnosis. That sample is going to be drawn from a vein, and it's going to be done at fasting and at random. Now, if this test is going to be used to monitor, then the sample is going to be drawn using a finger stick, and it's going to be drawn at fasting, after meals, and at random. The next test is the glucose tolerance test. It's also called the oral glucose tolerance test, and the other names listed here. It gauges your body's ability to metabolize glucose. It can detect or confirm diabetes or prediabetes. It measures the amount of glucose in the bloodstream after fasting, and then also after drinking a glucose solution. It takes samples at fixed intervals over 2 to 3 hours. Okay, so fasting is 8 hours without caloric intake. Now, the sample is going to be drawn at fasting. That's the first sample. Then the patient is going to drink a 75-gram glucose solution. Now, if the patient is a child that's taking this test, the amount of glucose that the child is drinking is going to be based on body weight, up to 75 grams. Now, this sample is going to be drawn from a vein. Now, the diagnostic criteria for diabetes. Now, if there's a random glucose that is drawn and it's greater than or equal, these values are going to be in milligrams per deciliter, with the exception of the hemoglobin A1c test. So, a random glucose of greater than or equal to 200 plus classic hyperglycemic symptoms or a crisis, that's going to indicate diabetes. Now, if there's a fasting plasma glucose that's 100 to 125, that's going to indicate prediabetes. If it's greater than or equal to 126, that indicates diabetes or supports the diagnosis of diabetes. Okay, so if after the 75-gram solution oral glucose tolerance test, after 2 hours, that plasma glucose, that sample value is 140 to 199, then that is going to support a diagnosis of prediabetes. If that sample value is greater than or equal to 200, then that's going to indicate diabetes. If there is a hemoglobin A1c of that is 5.7 to 6.4%, that's going to indicate prediabetes, and greater than or equal to 6.5 is going to indicate diabetes. Now, confirming the diagnosis of diabetes. If the patient is experiencing a hyperglycemic crisis or classic hyperglycemic symptoms plus a random plasma glucose of greater than or equal to 200 milligrams per deciliter, then a clear clinical diagnosis of diabetes is confirmed. Otherwise, 2 abnormal test results are required to confirm the diagnosis of diabetes. Now, the results may be from the same sample or from different samples. Now, using 2 separate samples, the second sample may be a repeat of the initial sample, such as, for example, 2 hemoglobin A1c tests. However, these tests need to be done as soon as possible. Both tests need to be done as soon as possible. Now, if we're using 2 different tests with the same sample, you can do the same as listed above. Now, if the 2 test results indicate diabetes, then the diagnosis is confirmed. But if the results are conflicting, then the test indicating diabetes should be repeated, and the diagnosis will be confirmed or denied based on the result for that test. Now, the glucose test for gestational diabetes. This test is done at 24 and 28 weeks of pregnancy. The sample is going to be drawn from the vein. It may be done earlier if it's expected that the mother has pre-existing diabetes or risk factors for gestational diabetes. This test can be a 1-step or a 2-step test. Now, it is very important to test for gestational diabetes due to the risk factors associated with it for the mother and the child. These babies of mothers that have gestational diabetes, the mothers run the risk of passing glucose on to the fetus, which will cause the babies to be born at a high birth weight. Some of these babies can reach 9 pounds or larger, which puts the mother at risk for needing a cesarean birth, and that poses complications in itself. These babies are at risk for jaundice, respiratory problems. Also, these babies are at risk for being stillborn, and the mother and the child are at risk for developing diabetes later in life. Now, screening and diagnosis for gestational diabetes. There's a 1-step strategy. A sample is drawn after fasting. That's no caloric intake for 8 hours. If that value is, these values are going to be in milligrams per deciliter as well. So if that sample after fasting is greater than or equal to 92 milligrams per deciliter, then that's going to indicate diabetes or support a diagnosis of diabetes. Now, the mother is going to drink a 75-gram solution of glucose, and a sample is going to be drawn at 1 hour. If that value is greater than or equal to 180 milligrams per deciliter, that indicates diabetes. A sample drawn at 2 hours that is greater than 153, that indicates diabetes. That is the 1-step strategy. Now, the two-step strategy. The first step, a sample is drawn after non-fasting challenge of 50 gram glucose solution at 1 hour, a value that is greater than or equal to 130, 135, or 140 milligrams per deciliter. These patients are going to proceed to the 100 gram oral glucose tolerance test. And that's going to be step 2 of the two-step strategy. Okay, so in step 2, a sample is going to be drawn after fasting. The value that is greater than or equal to 95 milligrams per deciliter indicates diabetes. These patients are going to have a 100 gram solution of glucose, and a sample is going to be drawn at 1 hour after. A value that is greater than 180 milligrams per deciliter indicates diabetes. At 2 hours, a value that is greater than 155 indicates diabetes. And at 3 hours, a sample that is greater than or equal to 140 indicates diabetes as well. So I think this is a good point to close this presentation out on. However, we do look forward to providing you with more information on this topic, this series, diabetes, also known as the sugar. If this presentation was informative or helpful to you, or you know someone who could benefit from this information, please like, share, and subscribe. Thank you.